Medicare Part D community meeting. My name is Katie Coombs. I'm on staff at Champaign County Healthcare Consumers as the Medicare 100 Plus Program Coordinator, and I'm also a community organizer. Today we're going to learn more about Part D, the problems with the current program, and what we can do as regular people to fix Part D. The Medicare Task Force has been working hard to prepare for today's meeting and is pleased to have so many people in attendance. As you can see from all the wonderful signs displayed here today, the task force has many fabulous volunteers who do a great deal of work. I'm especially proud of the Road of Hope that displays all the petitions we've gathered so far in support of a real Medicare prescription drug benefit. Before I review today's agenda, I'd like to take care of a few housekeeping issues. I hope everyone's comfortable. We've talked about the refreshments a couple times already, but please, there's plenty of food and drink back there. Help yourself if you'd like to get something. And as I mentioned earlier, the restrooms are right down the hall on the right side, so feel free to get up if you need to. We're all adults here today. I'd like to acknowledge the co-sponsors of today's meeting. Our co-sponsors include Active Senior Options, Ask Me Retirees of Chapter 88, Campaign for Real Choice in Illinois, Carl Foundation Hospital, Church of the Living God, Citizen Action Illinois, Family Service Senior Resource Center, the Historic East Urbana Neighborhood Association, the Illinois Disciples Foundation, Mount Olive Baptist Church, PACE, Provena Covenant Medical Center, and St. Mary's Church. I want to be sure to highlight the Senior Resource Center of Family Service and Andrew Butler, who's here today. This is a wonderful organization who's done so much work this past year to help people with their Part D problems, and I know they're going to continue to be busy. So if you are having any questions, concerns, or problems, please stop by their table after the program today. In addition, I'd like to acknowledge the representatives from our senator's offices here today. Today we're joined by Tim Sullivan from Senator Durbin's office. Come on over here. And Kathy Harrington from Senator Obama's office. And I see some other local elected officials and candidates in the mix, so welcome to everyone. We have an exciting and full agenda here today, so I'll get right to the agenda overview. Next up is going to be Claudia Lenhoff, our Executive Director at Champaign County Healthcare Consumers, and she'll talk more about why we're here today. Then we'll take a few minutes to watch an educational film about Part D. And after the film, we'll hear from national expert economist Dean Baker. Then he'll take some questions and we can have a short discussion. Our next speaker up will be William McNary, longtime community organizer, and he's joining us from Citizen Action Illinois. And that concludes the formal program, but we are going to have an activist training portion at the end of the meeting. And for the activist training, everyone here today can have a chance to go to the 4 different stations around the room and learn skills like calling your elected official, to share your concerns about Part D, and the meeting will adjourn after that. So I'd say we move right along here and welcome Claudia Lenhoff, the Executive Director of Champaign County Healthcare Consumers. She's worked. I wanted to hear what else Katie was going to say. Good morning, y'all. Thank you for being here. The purpose of today's meeting is for us, as local community members, to take action to tell Congress to fix Part D. We know that Part D is a disaster. We know that Part D is not a real prescription drug benefit for Medicare beneficiaries, but a profit-generating gift to the insurance industry and the pharmaceutical industry. For months, as we've been talking about the problems with Part D, and many of you have been living those problems with Part D, the media and others have said that we are complaining. And I don't know how many of y'all remember, but early on when we started talking about Part D, the News Gazette took out an editorial. We were saying how confusing Part D is, and they took out an editorial just basically saying people are just complaining and they just need to do some more and they can, work through this.
No, that's all right.
Well, we're not here today to complain, but to learn and then to take action to advocate for the best possible prescription drug benefit. Congress should make Part D the most efficient, cost-effective program possible that delivers real benefits to Medicare beneficiaries. And I just want to say, it's entirely possible throughout this meeting
that more of this will happen where these petitions, may pull down. It's the weight of, our voices and what we want done. So Congress is responsible for Part D because they passed the law that created it, and only Congress can fix Part D. So what are we doing here? What am I talking about when I say that we're going to work to fix Part D? We, the people, by ourselves, obviously can't change the law. If we could, we would have done it the day after it was passed. But as individuals who are part of this community, we can make a difference with the actions that we take, especially when we are part of a massive collective effort. And we are part of a massive collective effort. You will see that later today. It's hard to see it in our own community where we're gathering ourselves together. But tomorrow is National Donut Hole Day, where there are thousands and thousands of people and organizations around the country who are going to be voicing the exact same thing that we're talking about today. So we are part of a national network that is trying to make these changes. But then how do we move Congress to take action to fix Part D? Well, from this local community, we can't influence all of Congress. Unfortunately, we don't have to. We just need to work on our congressional representatives to make sure that they represent our interests, no matter what their personal views might be. In order to make our elected officials work for us, we need to build our power. And our power comes from our numbers. From the numbers of individuals like you who are here today, who are willing to take action, not just once, but over and over and over again. Calling your elected official and writing a letter and things like that is not like voting. You can do it more than once. So we are willing to do all of these things for as long as it takes, as many times as it takes, and to make sure that our representatives represent our interests. The other thing is that we can teach other people how to do those things too. So that, I can teach my family and my friends to do the same things that I have learned to do. And so today we are going to do just that. We are going to learn and we are going to take action. And as we do that, again, there are thousands and thousands of individuals and organizations around the nation doing the very same thing with their congressional representatives. So we just need to do our part by getting our 2 senators and our representative to stand with us and represent our views. The good news is that Illinois Senators Dick Durbin and Barack Obama, who have staff members representing them here today at this meeting, have pledged to stand with us and to do everything they can to fix Part D. And Senator Durbin is taking a leadership role in this. The fact that the senators have sent representatives from their offices to be with us today shows not only their commitment to this issue and to this community, but it also shows the power of our organizing and how it is possible to engage our elected officials. They knew it was important enough that this is a big enough issue to this community, that we are an active community. They wanted to be here standing with us because they want us to know that they hear us and that they stand with us. And they're good people and we have done good work, and that's how that has happened. Now we need to work on our representative. Remember, we got 3 to focus on, 2 senators, 1 representative. Our representative was invited to be here. Is anybody here from Congressman Johnson's office? Okay. Candidate running for representative is here, Dr. David Gill. Congressman Johnson was invited to be here or to send a representative. We know Congressman Johnson's personal views on Part D differ from what his constituents want. He said that in a TV broadcast where he was saying that he doesn't believe that it should be a Medicare administered plan, and he believes that the private insurance market can handle it better, and so on. So we know that his personal views are different than what we want. But he is elected to represent the people, not his personal views, and so we need to take action to let him know what we want. And we need to make sure that others know so that they can take action too. And then, of course, people can always go and take action in the voting booth as well. Thank you very much.
Well, thank you, Claudia. I was going to say that we wouldn't be here without her. But moving right along, we're going to have the film narrated by Walter Cronkite about Part D. So I've got some wonderful technical assistants here that are going to get us going. That was a very educational and powerful film, but that certainly doesn't capture everything about Part D. Our next speaker is a nationally recognized economist and co-director of the Center for Economic and Policy Research. The Center for Economic and Policy Research is based in Washington, D.C., and its mission is to provide consumers and organizations like CCHCC with information about public policy to promote informed debate. Dean Baker has recently released 2 reports that analyze Part D, the donut hole, and the record profits of pharmaceutical companies. To help us learn more about Part D, I welcome Dean Baker.
Thanks for organizing this, and it's great to see a lot of people out here today. It's obviously a very, very important issue. I really enjoyed the film. I hadn't seen Walter Cronkite anything for a while, and I was very disappointed that he didn't end it by saying, "And that's the way it is." But that is the way it is. I will say that. The basic story, as you all know, this is just a classic case of bad policy. It's one of these things sitting there in Washington and someone following the debate, a little bit involved in it, but obviously not in Congress. You're just saying they can't really do this. This is just really bad policy. It's really foolish policy. And the bottom line is it's costing the taxpayers a lot of money. It's $700 billion, more than $700 billion over the first 10 years of the program. And the key thing is it's not solving the problem. So $700 billion is a lot of money, but we had a real problem. We have a lot of seniors that have great difficulty affording their prescription drugs, and this doesn't deal with the problem. Just to give you a simple number on this, President Bush ran in 2000. One of his promises, of course, was that he was going to have a prescription drug plan. So, we come up with one 3 years later, goes into effect this year. Well, on average, seniors are paying more today out of their pocket for prescription drugs with the plan than they did back in 2000 without it. Okay, so where's the, and it gets worse, of course, because drug prices keep rising. We're spending $700 billion and we haven't solved the problem. Okay, so I just want to go over some of the points here, and basically, the film did a good job, laying out the basic story. So I'm just going to hit on some of the themes that the program talked about. What are the sort of obvious big problems with the program, and again about how to fix it. The obvious problems: first, high administrative costs. I'll come back and say a little more on each of these. There are very high administrative costs because it's being done through private insurers rather than through the Medicare system. Secondly, high drug prices. Drug prices in the program are much, much higher than they have to be, again, because we don't allow Medicare to use its bargaining power to push down drug prices. And third, the excessive complexity. And, this is very complex from a variety of different angles, obviously signing up for the program, doing the whole, et cetera. One last point I just want to make on that before I go into some more detail, just to emphasize this point. The donor hole today, kicks into $2,250 and goes after you spend $2,250 on drugs, and then everything's out of pocket until you spent over $5,100. It's like a $2,850 gap today. Important to keep in mind, they made this point, in the film, but that rises year by year. It rises in step with drug costs. The Congressional Budget Office projects that drug costs will rise at the rate of about 9% a year. So they actually gave the number for 2013. They said it'll be about 5,000. I actually had in my notes, I was going to tell you, well, in 10 years, it's going to be over 6,000. So this is a problem for people today, but the point is that's the beginning of the story. It gets worse. So people have right to be upset about it now, but you're going to have more to worry about, when we get out, 3 years, 5 years, 10 years. It doesn't address the problem. Okay, the basic story is the administrative cost. One of the great successes, if you look at Medicare compared to the rest of the U.S. healthcare system, administrative costs are much, much less than those of us who get their health care through the private insurance system. The administrative cost of Medicare around 2% of what they pay out for health care. If you look at the private system, it's on the order of 15%. Why is that? Well, they mentioned in the film. Well, private insurers have to do marketing. Medicare doesn't have to do marketing. Everyone's in it. They have to do marketing. Secondly, they have to pay profits. They have to pay dividends to shareholders. The private companies, they're looking to make a profit. And the third part of the story, the fourth part of the story is, you get some people at the private insurers who make big money as the top administrators. So if you look at the top executives of some of the big HMOs, some of the big insurance companies, they're getting $1 million, $10 million. They're getting very big salaries. You don't have that in Medicare. You don't have to cry for the people running the program. They get decent salaries, but they're not going to walk away with $10 million next year. Okay, so then those nice salaries, of course, come from somewhere. They come out of our pockets. Okay, so Medicare is much, much more efficient than the private insurance companies in administering health care. The obvious thing would have been to say, okay, let's just run this program through Medicare. You know, and again, it's sort of an interesting historical fact. Most of you probably know this, but you know, you talk to staffers or some members of Congress who aren't that old or not that knowledgeable. The reason why drugs were originally included in Medicare wasn't like a principled decision. Back in 1966, when they started Medicare, they didn't cost a lot of money. Okay, but there was no reason in principle that drugs shouldn't have been included in Medicare to begin with. It was just no one really thought about them as a big deal back then. Obviously, now drugs are a big deal. Okay, so the obvious thing would have been to simply include Part D as part of Medicare, and the Congressional Budget Office, you heard in the film, they did estimates of how much money that would save. It would save about $5 billion a year. It's about 10%, a little bit less than 10% of the cost of the program. That's a big savings. Okay, just right off the bat, just the administrative cost of the private insurers doing it rather than running it through Medicare. Okay, so that's the first part of the story. Second part of the story, okay, suppose Medicare had been allowed to negotiate for discounts. They mentioned the Veterans Administration. We could refer to them as one case, but in fact, we also have data. We know how much we pay in the United States for drugs compared to Canada, compared to England, compared to Germany, compared to basically any country in the world. We're the only country that just tells the drug companies that you can charge whatever you want. And as a result of that, you know, Medicare is paying prices that are on average about 50% more than what the Veterans Administration negotiates. The same would hold true if we're looking at drug prices in Canada. Some of you may actually get some drugs from Canada. It's a perfectly reasonable thing to do. We shouldn't have to do it, but you know, that's a way to save some money. Okay, so we pay about 50% more than Canada, and you know, go down the list, Germany, Australia, and it varies a little country by country, but in every single case we're paying vastly more than they are. And why is that? Simple story. All those countries negotiate directly with the industry and they get large discounts. Okay, much larger than the insurance industry is able to get.
Did the governor do something about that? Have a program where we can get drugs from Canada?
I don't know where that ended up. He did start to, I believe he backed off on that, but someone else here probably knows more on that one than I do.
It's currently available. Yeah, only 5,000 people are enrolled.
Okay. Okay. So there are. I mean, obviously, people do get drugs from Canada. It has an ambiguous legal status. You know, what's happened is it's not. Well, I won't get into the law on this. I mean, there has ambiguous legal status. I'll just leave it at that. So there are some issues. Obviously, a lot of people are able to get drugs. I can't answer all the legalities under what, you know, all the situations under when it's legal and when it is not legal. But we certainly, if we wanted to, could make it fully legal, and we'd have a lot more people getting drugs from Canada and saving a lot more money on their drugs. And insofar as the governors, a lot of people do that in Illinois, you know, through the state, that's great. I mean, that's really saving lots of money. Okay, but again, of course, it's a very backward way. It's a little silly for us to be, you know, drugs get, in some cases, they're produced here, shipped to Canada, and then you can cheap. Very backward way of doing it. Okay, the other point I want to make in terms of drugs or drug prices, it's important to realize, because, you know, sometimes people feel, well, we're kind of eating up on the drug industry, we shouldn't do that, you know. It's important to realize drugs really are cheap. Sometimes when you guys talk, you carry around a bottle of generic aspirin, you know, because how much is it, you know, you get that for $2 or something, you go to Walmart, I mean, it's not very expensive. Well, most drugs would be about $2. I mean, the fact is, in general, drugs are not expensive to produce. I mean, we want them to be produced with high safety standards, you know, that has to be ensured. But in the vast majority of cases, they're not expensive ingredients, not that we have to, you know, find some rare tree in the Amazon forest. There are some exceptions, but that's really, really rare. So almost invariably, drugs are very cheap to produce. So why are they expensive? Well, they're expensive because the government gives Pfizer and Merck and the other big drug companies, we give them patent monopolies. So we tell them, okay, you're producing Taxol, or you're producing Pfizer, whatever it might be, and we're going to arrest anyone that produces that in competition with you. We give them a monopoly. And if you need this drug, if you need the cancer drug, if you need the heart drug, and they're the only ones producing it, well, obviously, you know, they can charge you lots of money. You know, you need it for your life, you need it for your health. You're going to pay a lot of money if you can. You know, if you have the money to pay it. You know what's more important. So the reason drugs are expensive is because they give them patents. Now, again, there's a longer argument. I won't go into this, but there is an argument that yes, they need the reason for giving them the patents is they need the money for research. That's obviously part of the story, but the fact of the matter is, what they spend on research is a very small fraction of the money that they have coming in. It's no more than 20%, and even a lot of that money isn't going for breakthrough drugs or trying to find cures for new diseases. What they're trying to do is produce a copycat drug. They saw, that Vioxx is a big seller, or Taxol is a big seller, so they're trying to, break in on that market. So they're actually, much of their research actually isn't even going for developing new drugs that will meet unmet needs, find new cures or treatments. They're simply trying to break in on someone's market that's already there. Okay, so there is an issue about research. We should take that seriously, but that doesn't mean we have to pay the prices we're paying today. Okay, so suppose we told Medicare, we said, okay, offer the plan and go ahead and negotiate with the prescription drug industry. Well, presumably they'd be able to get at least the low prices as the Veterans Administration gets, or, flip your country or Canada, Australia, whatever you like. Okay, well, if they did that, we could eliminate the donut hole. I've done the calculations on this. You could do more than eliminate the donut hole if you wanted to. You could eliminate the donut hole. You could eliminate your copays, you could eliminate the premiums, and still money left over in the bank. Okay, that's how large the savings would be. Okay, now what I would probably say is, probably at least middle income, higher income seniors, you probably pay something, some copays or whatever. I pay $5 or $10 when I go to the pharmacist. For middle, higher income seniors, that probably is reasonable, not lower income seniors, but people have some means. Okay, you could do that, and maybe pay a little less money for the bill if you have a large deficit. But the point is, that's a really nice argument to have. We could figure out what to do with the money. There's a lot of money sitting on the table, which at the moment is in the pockets of the pharmaceutical industry as excess profits. It's still making plenty of profits. Again, every drug that they sell to the Veterans Administration, they're making a profit on. We know that they wouldn't do it otherwise. They're not actually selling the Veterans Administration at a loss. So they'd still be making profits, just somewhat lower profits than they are today. Okay, the last point, the complexity. I mean, this is one of these things that was just kind of painful because you go, why do you have to do this to people? You have people, and I've been on panels with people, and they like to say, they're free market conservatives. They like choice. People should have choice. They don't want the government dictating to them. And you just think about this, and it just go, okay, we don't want the government telling us what clothes we should wear, but we really want to read through insurance policies. I mean, it's close to crazy. I mean, who in the right mind would want to, spend their time, if you had the option not to go through these different insurance policies, deciding, which one offers the best plan for you. And, even that film didn't fully capture the complexity because, I'm sure all you realize, on the one hand, you're looking at, different co-pays, deductibles, and different drugs covered, and then, you have a good deal, one plan might have a good deal on drugs to treat arthritis, but, if you have diabetes, they don't give you, it doesn't deal with the drugs for diabetes, and then as they point out, they could still change the prices over the course of the year. So you think you got a good plan because you need drugs to treat diabetes, and you find out 6 months later, well, they've raised the price on that. Well, you got a lot because you can't change the next year. But even that's not the whole story, of course, because part of the issue is, you start the year and, maybe you don't have a problem with diabetes, but 3 months in the year, 4 months, you're talking about, hey, you need medication. People's health changes. So you're in this situation that, you're obviously going to make your decision when you roll a plan at the beginning of the year based on your health at the time. But you don't know what your health is going to be 3 months, 6 months into the year. So it throws this uncertainty, this sort of gambling into it, that why do we need this? And again, it's one of these things, I've been on some panels with people and they mock, oh, how hard can it be? And I remember once I was being interviewed, actually a totally different issue with the reporter, when I was talking with the reporter about it, we were talking about this last night, talking with the reporter about this, and he actually brought it up, he goes, people are complaining about it, it doesn't seem a big deal to me, I signed my mother up last week, and he volunteered his mother, I guess it was just over 65, he said she's in good health, she only has a few prescriptions, I go, how long did it take you? He said, oh, it's only about 3 hours. So I think, here's this guy, he's younger than me, he's used to using computers, he's a business reporter. And it took him 3 hours to sign up his mother, who's in good health. Thinking, that's a good story. I mean, and we have research on that. There's a Medicare advisory commission that actually did a study of this, and they looked how long did it take people on average to select a plan. And they found that the median, half more, half less, was 8 hours. It's a median. So again, a lot of people are probably people like this guy's mother that, they have 3 prescriptions, probably didn't take them a long time. So if the median was 8 hours, you probably have a lot of people that spend, 15, 20 hours, 30 hours. I mean, this isn't a good use of people's time. Okay? It's not a good use of their time, and it provokes anxiety in just ways you don't need. There's other aspects too. I mean, they mentioned this a little bit about the chaos in January 1st. I mean, it's kind of sidebar because hopefully, it's a one-time thing, but when you implemented the plan, this was just kind of like, what were you guys thinking of? Because, we had about 8 million people that were already getting their drugs covered through Medicaid. Lower income seniors were already getting their drugs covered through Medicaid. So what do? They go, okay, January 1st, you're in the plan. Are you ready for that? They said, oh, we're ready. Well, no, they weren't ready for that. And you had hundreds of thousands of seniors falling through the cracks. And, this is one of those things you go, you didn't have to do it all on January 1st. I mean, suppose you pick 3 states, one in the Midwest, one in the Northeast, one in the West. Let's see what happens in Iowa and Maryland and Nevada. We'll have them do it on January 1st. Everything goes well, then, 30 days later, we'll do it with 10 states, And then, since these people are already getting their drugs, they're already getting paid for through Medicaid, why did you have to do it all at once? So it was one of these situations where you caused a lot of people, great anxiety. Many people weren't able to get their drugs because they were supposed to be in a plan. For whatever reason, they weren't assigned one or they hadn't signed up for one, whichever, so they couldn't get their drugs. And then you had the pharmacists. I know I've been in Washington with some people at the Pharmacy Association. A lot of these pharmacists, they did the right thing. They filled prescriptions not knowing if they'd be paid. In some states, the states came in on an emergency basis, picked up those prescriptions. In other cases, the pharmacists simply on their own said, well, you're not covered. They knew that people, the Medicaid population, for the most part, they can't afford $100, $200 out of pocket. They're not expecting it. So the pharmacists did the right thing and picked up the tab, but they shouldn't have been in that situation. Okay, so this was just, it was, again, I say it's a one-time thing because we're not going to be rolling the Medicaid population into the plan every year, but it just shows you how poorly thought out, this plan was. Okay, last point I want to make in that respect is just how kind of bizarre this idea of a donut hole is. Because it's, if you think about this, we're talking about insurance, and, I can't think of any other insurance. I mean, can you imagine if you had your car insurance and it said that, you have your standard deductible. I mean, you're paying your premium every month or, how you pay it twice a year, whatever it might be. And then if you have an accident, of course, you have your deductible, $500, whatever it might be. And then they told you, and then we'll pay the next $3,000. But then if your damages are more than $3,500, we don't pay you anything unless they're above $10,000. I mean, would anyone buy an insurance policy like that? Imagine that on your house. I mean, it's no one. I've never heard of an insurance policy designed that way. And it was just. It was just this political thing because they wanted to say that they're giving everyone a prescription drug benefit when the way they structured it, they didn't have enough money to do it. We would have had plenty of money to do it if they'd done it the right way, but the way they structured it, no, we don't have enough money. We can't pay the drug industry these prices and let the insurance company walk off with these profits and still give people a good drug benefit. So what they do is they come up with a donut hole. Okay, it's just really, really bad policy. Okay, well, what's the solution? Again, you heard the story in the film. The basic story would have been, at least in my mind, the obvious thing would have been just have it provided through Medicare. Now, as things stand in Congress, you probably would never get support. I shouldn't say would never, but it'll be involved to get support. But actually, your senator proposed a bill that gets you 90% of the way there. It just says, okay, let's let Medicare offer it. And actually, I kind of like this because, what it's saying is, we'll let Medicare offer the benefit. Medicare, of course, will negotiate with the industry, but we aren't requiring it. So if you really want to go with the private insurers, go ahead. And the reason why I kind of like that is because I get on panels with people and they say, what's wrong with giving people a choice? I was on, very involved in the Social Security debate. They said, oh, why should everyone get the one size fits all? What's wrong with giving people a choice? I can usually tell them. But, but in this case, I get to turn around and go, what's wrong with giving people a choice? So we have the answer, and I mean, my guess is that probably almost no one will want to sign up with the private insurers, but I guess if they really want to, I wouldn't stand in their way. But the point is, if we have Medicare offer a simple benefit, affordable benefit, no donut hole, it's available to everyone, that gets us 99% of the way. And, I don't know, if some people really want to pay more and have a complex benefit, I guess, that's the way to roll. But that would take care of our needs. It can be done. And, obviously it's going to be a big political battle, but I think we can get managed to do the right thing. So, let's stop with
Well, that was a very educational discussion. I know I learned a lot and had my conclusions affirmed. So it was great to hear from Dean Baker. We scheduled a break here for some discussion and questions if people want to do that. Or we can keep moving right along because we have another wonderful speaker. Hope you do mind coming up and fielding some questions? Okay, we have one right in front here.
No, I'm a member of SSI, and they paid all of my prescriptions, and they increased my copay by $7 a month, which is $84 a year when they went to medical. And I just received, I have both through the company medical, and they just mailed me that they pay for only 5 of my nine medicines. And I can't understand that. And they put what Medicare will pay for and what I pay for on the other side. In other words, they couldn't put in the copay part of that. Then, but I have four medicines that I believe I looked through their book and they did cover. Did cover that. So is it the insurance company then that's covering that for me? Or is it,
I have to say, I can't really,
Medicare?
I can't really say how that's being covered. In principle, you're not supposed to lose coverage of drugs that you had covered. Now, in particular cases, I'm sure that is happening. So, who's picking that up? Probably.
Well, I'm getting all the medicines that
Yeah.
I once had, which is fine. And through medical, I have had no difficulty whatsoever. But I'm one of the very few. But with this copay, I found out that if you get your pay set, that the pharmacy will allow you to get your medicines 3 months at a time. Well, my monthly copay is $16. So if I get it 3 months at a time, I will save $32 every 3 months by getting 3 months at a time instead of just 1 month.
And that sounds pretty confusing. I think a lot of people have the same experience that their co-pays have gone up as a result of Part D. I know here in Illinois, the Illinois Prison Record Program, formerly Senior Care and Circuit Breaker, those co-payments went up. Medicare and Medicaid beneficiaries co-payments went up. So I think that's a universal situation for people. And
They
is there any
made it out like it was a benefit to us, and they didn't give us anything. They charged us home.
right? Is there anyone else that would like to? Right there.
I don't understand. I'm sitting there looking at this thing, fifth part either. That bill is 60 pages. How are you going to fix it when you've got 60 pages of it? And if you put it on regular Medicare, that doesn't make our Medicare.
Can you repeat the
I
question?
mean, you don't know. You don't know.
What's the question?
Okay, well, the question was, how can you fix it because it's a complex bill, 60 pages? Actually, when I saw 60.
I haven't gotten it.
I think it was summary, but in any case, it is a complex bill. And then the question was if they do fix it, would the regular Medicare go up? And the answer is, it is a complex bill. And one of the reasons why it is so complex is because the way they did it by offering it to the private insurance industry, it would not have been, a lengthy, complex bill if it were offered as an add-on to Medicare. And secondly, no, there'd be absolutely no reason why Medicare would have to. I mean, again, the reason why you could give people lower co-pays, premiums, eliminate the donut hole is basically the savings that if it were done through Medicare, you'd be paying much less for the drugs, and secondly, the administrative costs would be much less. So there'd be absolutely no reason for Medicare payments.
I went to get my prescription last month. No, because I said, what? I had to call 10 people, the 11 to 12 person fixed it, but they didn't explain it. These people did not know. Nobody knows what it's about. And I think it's a lot of time, and I still didn't get they straightened it out for 1 month. And then I go back to where I was at. But I didn't get an answer. And I think our congressman had been paid off. I'm sorry, but that's the way I feel.
Yeah, a lot of people have found that the experts at Medicare can't get their facts straight either, so I'm sure that there's more people in that situation. Right behind you.
I may be asking you just to repeat something you said, but just to settle, I'm sure Elaborate on one thing, and that is the drug company's central argument that if Americans don't pay these prices, that research is going to suffer terribly, that all these new medical advances that are in the pipeline and that will be in the pipeline are threatened if the Americans don't pay the prices. Once again, you said that less than 20% of their profits goes to research. Is that correct? And much of that is to copycat firms.
I'm sorry, if I said profits, I misspoke. Their sales. So that their sales worldwide are in the order of, well, if we just take the U.S. pharmaceutical industry, I'll make it simple. Their sales are around 230 billion a year, and they say, I'm saying they say because we're not auditing it, they say that they spend around 40 billion a year on research. So that's less than 20% of their sale price. Now their profits are on the order of 40 billion, so their profits are roughly the same size as the amount of money they spend on research. Okay, so it's about less than one-fifth of their sales price. That money goes to research. And of that, by the way, the figure that you get for copycat research, roughly 60 to 70%. The way we can get this, the Food and Drug Administration, when a new drug is approved, they rate it as either a priority drug, meaning that it's a new treatment, a new cure, something that didn't exist previously, or a standard approval, meaning that essentially something like that is already on the market. Doesn't mean it doesn't add something, but something comparable is already on the market. And around 70% of the drugs that they approve are in that standard category, meaning they're duplicating the function of existing drugs.
I thought the research was done like the Cancer Society and the Heart Society.
That's a very good point. Much of the research that is done on prescription drugs at the more basic level is done either through the federal government. We pay for about 30 billion a year in prescription drug research directly. I shouldn't say prescription drug, biomedical research through the National Institutes of Health. And then on top of that, you have you have various charitable organizations that spend perhaps another 5, 6, 7 billion a year on research.
Okay, I think we have time for 3 more questions. If people could stand up and speak loudly, I'd appreciate it when you ask your question. Connie, you are first.
I'd just like to make a comment for that first, in that they get a lot of their research and development money from the government, for which we pay also. They get a certain percent. My question, and please don't think for 1 minute that I'm against Part D at all, but when they talk about Social Security benefits in the future declining anyway, and we have to do something about Social Security and Medicare, and then putting Part D on top of that, will that mean that the money will be gone sooner? How does that fit in?
Okay, so
That we're adding something and there's not enough money anyway.
Okay, a couple things. Just one more thing on the drug, the research. There's actually, I think the way we support research is very, very backward in this country. And there is actually a bill that was put forward by Dennis Kucinich, a congressperson from Ohio, that proposed basically increasing the amount of money that we spend on research. So that instead of spending 30 billion a year at the National Institutes of Health, suppose we raised it to 60 billion. And you actually, instead of just doing basic research, you actually develop drugs through the whole research process, through the FDA approval process, and then you allow every new drug to be sold as generic. And in all drugs, if I were holding on my bottle of aspirin, generic aspirin, all drugs would be like that. So in principle, you could talk about other ways of financing research. I think the very backward way of doing it right now leads to a lot of corruption. So I think we can find much, much better ways to do it. Now the question here, okay, so we're adding this, we have a problem with Social Security. We actually don't have much of a problem with Social Security. People have been working for decades to scare the public about Social Security. Not to say that over a very long term there aren't problems, but the most recent projections from the Congressional Budget Office are that we did absolutely nothing. We could pay every penny in benefits through the year 2046. And then even after that, we could still pay about 80% of benefits, even if we never did anything. Now, somewhere, the sort of long-term problem we face, I don't think there's a problem, but the sort of long-term problem is we're projected to live longer lives. So that does cost more money. So somewhere, my guess is we'll probably want to raise taxes. Maybe we want to raise a retirement age at some point. not this year, not next year, not in 10 years, but somewhere we might want to do these things. But the idea that, this is facing some imminent crisis, the problem, we're about to run out of money, that's a scare story. It's just nonsense.
The money is not there, though. I mean, they
Well,
have used it for other
the
things.
money is there in the sense that the fund holds U.S. government bonds. So, what you could say is our federal deficit getting too large? Now, that's not a question about Social Security, that's a question, what's our overall tax and spending policy? And I think there are issues there. We had a big tax cut, a couple big tax cuts. We're having a war in Iraq, which costs a lot of money. I mean, I don't see this as reasons we really cut Social Security and Medicare, but yes, I mean, we do have to look carefully at the overall budget situation, but none of these, to my mind, are reasons to cut Social Security and Medicare.
We have another question today.
I have a comment more than a question. Claudia mentioned that I'm here. My name's David Gill. I'm running against Tim Johnson for his seat in the U.S. House of Representatives. Thank you. And I consider Medicare Part D a moral failure on the part of Mr. Johnson. I was disappointed that he's not here this morning because he needs an education with regards to this. But the fact of the matter is, he's a very intelligent man, and I think he understands this. This woman over here said, I think our congressman was paid off. Well, that's what happens. He takes checks from GlaxoSmithKline and Burroughs Wellcome. Walter Cronkite mentioned tens of millions of dollars in campaign contributions go to these guys, including Mr. Johnson, and that's not how I'm funded. And he's not here today. He's also not in my emergency room where I work and where I see the people that have fallen into the donut hole. I see people struggling to breathe because they can't get their medications for their congestive heart failure anymore, and he's nowhere to be found as far as helping those people. And so I came out here today to thank Champaign County healthcare consumers for putting this together. I think it's tremendously important to educate people, and it is a political battle, but it'll be made much easier when we have different people in Congress. And so I'd like to ask for your help November 7th.
Okay, do we have anybody else? You've already had a chance to speak, so we have time for one more. Is there anyone else that wanted to slip something in before we leave on? Okay, if you could keep it short, I'd appreciate it. Okay, thanks.
I received a letter through the mail. I received a letter through the mail, and it stated that I had to fill out a form in order to assure me that I would be able to, in the year 2007, that I would still be able to be covered by D, by Program D. And I phoned the number, and it rang and rang, and I phoned it different times of the day. I thought, well, maybe I'm phoning at the wrong time. I never got any answer. And I talked to another people in my apartment building, and they received one through the mail. But I've never received one through the mail, so now I have no idea where to go to get this form. I called Social Security, and they said that I was covered. So not to worry.
Well, I just want to remind everyone that Family Service is right over here in the front. Andrea can answer specific questions about your problems with Part D. And yes, everyone does need to re-enroll with their Illinois CareRx for 2007, and Illinois CareRx does require that you sign up for the Extra Help Program. So Family Service can answer those individual questions.
Well, I had to sign up for Extra Help
Right.
to get everything I've got now.
Well,
So
all
why do
right.
I have to redo that?
Andrea can talk about that.
Let me make a parting comment.
All right, a final comment, and then we'll
Listen
move
just for a
on.
moment, for a very fast moment. I'm Reverend Robert R. West, and Dr. Gill. I would encourage the community to give him a vote with Tim Johnson, because I think it's much needed. Needs diversity in our community, and he will bring that to the people, the senior citizens. I am a senior citizen for many, many years. I think we should I have a radio program. I got a radio program, WFT.
All right.
Just a moment before we move on to hear William McCarran. I just wanted to make very clear, Champaign County Healthcare Consumers is a 501c3 organization. We are not allowed to endorse any candidate. We never tell you who to vote for. What we do, I understand this is our event though, okay? I understand. What we do It's fine. What we do is we give people the information that they need, and we remind you, you can take action in these ways, and yes, you can take action in the voting booth. I just wanted to make sure that people understand that healthcare consumers is not telling you how to vote, but we do want you to vote, and hopefully you're learning a lot today that helps you make that decision.
Well, thank you, Claudia. It's always good to keep that in mind. I'm glad that we have such an enthusiastic and intelligent crowd here today. I'm looking forward to seeing everyone in action put this enthusiasm to work productively here today. But before that, I'm very happy to introduce Mr. William McNary. William is the president of U.S. Action and co-director of the Illinois affiliate Citizen Action, a consumer watchdog organization that works at the state level and has worked in partnership with CCHCC on campaigns like the recent struggle to protect Social Security from privatization. Citizen Action is like a big sister organization for us, and it was during the Social Security campaign I first heard William speak. He motivated me, he moved me, and he filled me with passion. I know he'll do the same today, so please welcome Mr. William McNary.
Thanks, little sister. Well, good morning.
Good morning.
You know, my mama always told me you can tell what kind of a crowd you're standing in front of by the way they greet friends, or by the way they greet strangers when they greet you. So let's try that again. Good morning.
Good morning.
Now that's more like it. You all do my mama proud. At Citizen Action Illinois, we say there are three kinds of people. There are people that make things happen, there are people that watch things happen, and then there are people that don't know what's happening. I can't think of any place else in the world I would rather be on a Thursday morning than right here in Urbana, Illinois, the town of the prestigious and world-renowned University of Illinois, where my brother Fred McNary went to school and graduated from, in a room full of aggressive, progressive citizens in action. People who are not just content to sit on the sidelines and watch things happen to them, but people who are active participants in the movement for social justice and social change. I truly believe, because you all are gathered here this morning, that people will live longer and people will enjoy a higher quality of life because of the work that the activists in this room in general and the Champaign County healthcare consumers in particular have done, are doing, and getting ready to do. And because we activists are often inundated and underappreciated and undercompensated and seldom celebrated, why don't y'all celebrate yourselves right now with a great big hand? Let them hear you all the way to the White House. To all the people who spoke before me, let me first of all thank you for challenging our heads with good information, challenging our hearts with good inspiration, and challenging our feet with good instruction. Having me speak at a forum like this is never a 50-50 proposition. I guarantee you I've already received more inspiration and more knowledge than I can give. So with that disclaimer, let me tell you, like Elizabeth Taylor told her last husband, I won't keep you long. Let me be a real brief and tell you why it's important that you are here today. U.S. Action, we're the nation's largest organization of statewide grassroots organizations. We're in 23 states with 33 affiliates, representing over 3 million members. And if you can sum up what we believe that every man and woman who wants to work is entitled to a livable job with a living wage and safe working conditions and a secure retirement. But in order to get that job, we believe that every child is entitled to a high-quality public school education, regardless of where they live, or regardless of who they were born to. But what difference does it make if you're the smartest person in the world, or you have the best job in the world, if a major illness can wipe you out overnight? A major illness is the number 2 cause of bankruptcy. It used to be number one. Number 1 cause now is losing your job. Number 2 cause of bankruptcy in this country. So we believe that high quality, affordable health care should be a right guaranteed to all. And we got the audacity to believe that we can enhance and improve the quality of our lives with an environment of arsenic-free water and pollution-free air and pesticide-free food. Make no small plans
titles. They do not excite men nor women's souls. But if we are to achieve this vision of a more just and moral world, we can't say that we're to the left of everybody else, and we're brighter, and we're smarter, and we're pure, and we're better than everybody else. That's elitist. We have to see ourselves in the center of people's lives, because that's where we are. That's where we live. It is not us. It is our politics. It's our political direction that is off-center. And we have to move our politics and our politicians closer to where we are. There's a lot of talk in Washington, D.C. about values. Well, I'm here to tell you right now that values are more than just pious posturing. There is a government document that reflects our values, and it is called a budget. And when the federal government makes the wrong choices, it is the American people that pay the price. We need to change our politics in 3 ways. Number one, public policy, which is issue campaigns designed to make sure that we move our politics in the right direction. But we also need to do politics. We need to elect those people who represent us. And lastly, we need people power. The more, the better. When you read out that list of all the people who support this program, that's the start. And we need to build on top of that. Issues to elections and policies to politics. Because policy not connected to politics will get you endless conferences, white papers, and position papers that will sit on the shelf and gather dust. However, politics not connected to policy will get you unaccountable political actors who are only driven by the size and ego of their own ambition. Now, some people say, well, McNary, why can't you separate policy from politics? Well, Congressional Quarterly, July 29, 2005, quote, in his remarks to the lobbyists on Thursday, then House Majority Leader Tom DeLay, Republican of Texas, said beneficiary support of the added prescription drug coverage will be a boon to Republican lawmakers in the 2006 midterm elections and in their efforts to enact privatization to Social Security. Quote, if we have credibility with seniors on this issue, they will start trusting us on Social Security, end quote. Now, you have me to separate policy from politics. The House Majority Leader, he don't separate policy from politics. I'm a firm believer, and this proves it. If you don't do politics, politics will do you. He sees the Medicare prescription drug issue as complementary to the Social Security issue. It's not a competitor issue. It's not a success issue. It's all the same, one seamless whole to him. He sees it as a way for Republicans to move seniors in the 2006 election because he knows that senior citizens are disproportionately represented in their numbers in the off-year election. Senior votes higher in the off-year election than anybody else. And just like them, we are not going to let the Medicare, we see the Medicare prescription drug issue as complementary to the Social Security issue, and we're going to fight this issue and win this issue just like we fought and won the Social Security issue, because we're going to do it in the same way. Learn the lessons, and the lessons were, number one, we're going to build a big, broad-based coalition of people to fight this fight. You just heard some. Community groups, civil rights groups, civic organizations, faith-based groups, labor, seniors, disabled, young people, all of us fighting together, all of us working together in a disciplined way. We are running a campaign. This is our next battle. We're going to take this message in the field. Change is not going to happen in Washington. It's going to happen in the communities where we live. That's why we're here today, to get the information to take to our elected officials and make them change the direction of our country. We're going to be equally vigorous, equally disciplined, and equally aggressive, and we're going to be united and rise above our various interests and factions and divisions. And we've learned if we can do that, we can change the political terrain. We did it once last year on Social Security. This is the year we'll do it on Medicare prescription drugs. Y'all with me? Sit down here while I'm on a high note. Let me close. You know, this Congress could mess up a one-car funeral. All they had to do, was add a prescription drug benefit under Medicare. That's all. If they had done that, just like we have doctor visits covered, just like we have hospital visits covered, we could have prescription drug benefits covered, and then Medicare could have used the power of 40 million people, seniors and persons with disability on Medicare, to negotiate for the lowest prices for prescription drugs, just like the VA does it now. That's all they had to do. And that's all seniors wanted, was a guaranteed benefit that was affordable, simple to use, simple to access, simple to understand. Instead, what do we get? We get this Medicare Part D, which is a crapshoot of a plan that is costly and confusing and corrupt. 4 out of every 10 seniors are going to fall into a donut hole. For everyone with drug costs above $22.50 a year, the Part D in disaster stands for disappear. That's because 38% of the people who sign up fall into this donut hole, and that's where they're going to stay. And if you're in that group, your coverage ends when your costs hit $2,250, even though, as you heard, you still have to pay the premiums. And of course, you still need your medicine, but Part D won't spend another dime to help you out until you spend $5,100. And so most of the people who fall into this donut hole will never get able to get out. And that's no benefit, and that's not Medicare. And the only reason the donut hole exists is that Congress won't let Medicare negotiate for the best possible prices. And without that power, prices keep going up. Taxpayers lose, seniors lose, and people with disability fall into the donut hole. This is a disaster of a plan which put drug companies and insurance companies first. We need a plan that puts seniors and people with disabilities first. We need a real prescription drug plan under Medicare that is simple and affordable and that is guaranteed. Now, you said this is costly, this is corrupt. I see it's costly, I know it's confusing, but what do you mean by corrupt? Well, let me tell you what I mean by that. The real Abram Hoff lobbying scandal that they're talking about, it's not about who you travel with. It's not about who you eat lunch with. It's not about who you work out with. The real Abram Hoff scandal in Washington is that private interest money is being used to purchase public policy outcomes. When you have gas and oil companies meeting in secret with the vice president and then come out with a bill that gives them taxpayer subsidies on top of record profits while the average working stiff is having a hard time filling up his gas tank or keeping his home heated. When they pass tax cuts that benefit the wealthiest of Americans and then benefit cuts for everybody else. When they go and listen to the drug companies and insurance companies and write a prescription drug bill that gives them more benefits to their bottom line than benefits to seniors, leaving seniors confused and angry and paying more for prescription drugs than when Medicare was first enacted, more than ever. We need a system of public financing of elections in our country that lessens the influence of big money, and your viability to run and win office is based upon what you stand for and who you represent, not how much money you got, and where you spend more time raising issues and raising hope and raising hell if you have to, but not having to raise money. If I was Tim Johnson, I'd be camped out on Speaker's door, begging him to let me offer what we're talking about here. I would be out there saying, this is what we need to be working on. Because if we do not, we will have hell to pay in our communities more than ever. We need a government that protects the weak from the strong, more than ever. We need a government that protects everyday people from the exploitation and abuses of power. We need a government based upon the values of the late Senator Paul Wellstone. He believed that every human being had equal worth. He believed that every human being has a right to live a meaningful and fulfilling life. But he also believed that beyond our own individual concerns, there is a broader concern that prioritizes our communities and our mutual well-being, and that government should be used as an instrument to provide for that common good. This isn't about more government or less. When our opponents say less government, they say less Medicare, less Medicaid, less student loans, less safety net. Let's be clear. They're perfectly happy to call on government when it comes to snooping through our briefcases, our computers, or listening to our phone calls. They're perfectly happy to call on government when it comes to telling women what choices they can make about their own bodies. They're perfectly happy to call on government when it comes to deciding who should love whom. They're perfectly happy to call on government when it comes to keeping cheaper medicines out of this country from Canada. But this is America, and just like Martin Luther King said, we are all interwoven in a single garment of destiny. What affects one of us directly affects all of us indirectly. We all do better when we all do better. I believe that this war in Iraq, my own personal opinion, is an unjust, immoral, and probably illegal war, and will go down in history as a colossal failure by any measure. The cost in lives, the cost in money, the cost of our moral standing in the world, but regardless of what you feel about the war in Iraq, once we as a country made a decision to go there, we have spent, go to www.costofwar.com. I go there before I make any speech, and this is fresh off the press. This is what we spent so far. We have spent $316 billion. For $316 billion, we could have paid for 42 million children to attend a year Head Start. We could have shared 189 million children for a year. We could have hired 5 million additional public school teachers for a year. We could have built 3 million affordable housing units. We could have provided 15 million students with 4-year scholarships. So don't tell me this is about price. This is about priorities, and we need to change our nation's priorities. I told more than once. This is my final thought. We need to get a real prescription drug benefit under Medicare, and we're going to do it. And don't let them tell you that it's too much, it's too big. And please, whatever you do, don't let them tell you it's not the right time, it's not politically viable. Because if they say it's not politically viable, that's okay. At least they didn't tell you you were wrong. Because I think it's hard to do. It's hard to make wrong right. That's hard. But it's not necessarily so hard to make what is politically not viable now politically viable if it's right. It's always wrong. Always wrong to deny women the right to vote. Always. Always. But one time it was politically viable to do so. And so suffragettes had to get together with other women, had to get together with like-minded men and other citizens, and make what was always morally right, politically right. And now we have women mayors, school board members, state legislators, women governors, women in Congress. We have a Democratic House leader who may be the first woman Speaker of the House next year, and we have a woman Secretary of State, and someday we may have a woman president someday, and that will be all right. It was always wrong to keep black people in slavery, always. Always. But at one time, it was politically viable to do so. And so freedom fighters had to get together, abolitionists had to get together with other like-minded men and women, and we had to fight a war. But at one time, we made what was morally right, politically right. And not only do we have black elected officials in all areas of government now, the most popular politician in America is a United States Senator from Illinois with a funny name, and some people say he's the President of the United States. So if I was convinced that God had created Medicare Plan B, I would go back over there and sit down. But mine is too short about for God, and so are yours. Congress created this plan. That means that Congress can fix it. Politics. So some people didn't vote for this bill, they want to fix it. They should be sent back. Some people who voted for this bill, who don't want to fix it, a lot of them ain't coming back. Some people who voted for it, they were confused. They can be moved to fix it. We hope that's where Tim Johnson comes in. He just screwed up. We all make mistakes. We all screw up. Sometimes. Some of us screw up more than others. But we're going to get trained today, right after we leave here, to figure out how to approach Tim Johnson. There are two reasons that people don't move. It's not because they're apathetic. They don't move because, number one, they don't know the facts. But after the day, I guarantee you, what you've heard from all of our panels, all the speakers, water, now y'all know the facts. Either they don't know the facts, and they don't know the facts, or they don't know what to do when they know the facts. Well, I'm just going to tell you, I need you all to go out here tonight, after the day, roll up your sleeve and approach Congressman Johnson with an expectation of hope and success. Just go out and speak the truth as you have learned it, as you know it, with conviction, with compassion, and with clarity. What do you want? All we want is for you to offer a prescription drug benefit under Medicare and let them negotiate prices on it, and then use the savings from these negotiations to get rid of the donut hole. Everybody can understand that, can't you? I love a simple message. Hope, the rope of hope, not cynicism. Too much cynicism kills the spirit. A little of it's healthy, too much kills the spirit. You ask him, does he want to be an eagle? Or does he want to be an ostrich? Does he want to bury his head in the sand and act like there are no problems with this planet? Or does he want to be like an eagle and soar above the politics and the special interests and come up with a real prescription drug benefit plan that benefits the people? And we're going to need one of two things out of Congressman Johnson. Either we're going to get good policy, or we're going to get good politics. We're ready for either one. I learned my values in 3 places. I learned my values in my home. I learned my values in my church. And I learned my values in a public school system without even knowing it every day. The teacher made me get up and put my hand over my heart and say, one nation, under God, indivisible, always together, with liberty and justice, not just for the privileged few, not just for the ones who were born with silver spoons in their mouth, not just for the ones who were born on the right side of the tracks, not just for the ones who have the best lobbyists, but the liberty and justice for all. My fellow citizens, my fellow brothers and sisters, whatever you do, occasionally you may lose an issue. You may occasionally lose an election. But don't you ever lose your passion for liberty and justice for all. You are the right people at the right place at the right time in history. Go out and take your country back from those deficit-creating, treaty-breaking, environment desecrating, inequality escalating, influence peddling, fear-mongering, secret-keeping, memo-leaking, race-baiting, free speech-hating hypocrite, and take America back. Give it to the people.
Well, I sure wasn't kidding, was I? Wonderful speaker. And after that, how can we all not take action here today? I'd like to ask the volunteers that are going to be working at the different activist training stations to go ahead and move to them at this time. We've learned a lot about the problems with Part D today, of Medicare beneficiaries, I've seen a lot of the problems with Part D, and the people with Part D have lived the problems, as have their families. Today we learn these problems are not isolated cases. The Part D program has problems built in. The donut hole is extremely harmful, and we learned it's completely unnecessary, and it's a bad way to attempt to control costs. The costs are not contained, they're passed on to Medicare beneficiaries. Even those of us who haven't been harmed by the donut hole or other problems with Part D are not getting the best benefit possible. If Part D was administered by Medicare with the authority to negotiate discounted drug prices, everyone's costs would be going down. The current Part D program falls short. It harms Medicare beneficiaries and wastes taxpayer dollars, while insurance and pharmaceutical companies continue to reap record profits. Today we have an opportunity to speak out to our elected officials in Congress. They created Part D, so they need to hear from us, so they know that we need them to fix it. We have 4 different stations here today. We have a petition station in the back. You can help us to build onto our robocall. You can add your name to the petition and be trained on how to carry petitions. Reverend West will be over there. We have a station where you can make phone calls and call your elected officials. Right up here in the front, Jen's already up here. And you can have the phone number available, those scripts, and it's very easy. Jen can help you call Representative Johnson right now. We have a station where you can write letters to the elected officials. You can write Representative Johnson today, right over here. We have his address, some ideas for writing your letter, so please visit Midge and Claudia and George up there. And then we also have a station for writing letters to the editor. You know, everybody reads letters to the editor, including our elected officials. So if you want to do that, head right to the back, and Ryan and Eleanor and Harold can help you write letters to the editor. So after this, you're free to leave. So I want to take a moment to thank all of our wonderful speakers and everyone that helped out today and all of our co-sponsors. So let's give everyone a round of applause. And I want to make sure that everybody knows that the Medicare Task Force meets regularly. We meet once a month, the 3rd Thursday of the month. Our next meeting is going to be October 19th at the Civic Center. The yellow sheet on your agenda has the meeting information. We'd love to have more people come out to the next meeting and continue to grow as this movement spreads across the nation. Tomorrow is the National Donut Hole Day, so what we learned here today we can bring to our friends and neighbors and take action as a country tomorrow. So thank you for coming out, and let's take action. Go to those tables.